When you talk about IVF unit comprises of different departments or specialists who are only focused on sperm from the man and the eggs from the woman. IVF is generally talking about every approach, every intervention that you can take on a couple, on two partners, without them having to lay on each other in the bedroom. Fertility is just a regular illness, right? It is a regular illness, like malaria, like typhoid. The cure, the management of infertility is over 4 decades now, globally. And there have been millions of children delivered from this technology. A couple desiring the fruit of the womb must have sex 2 to 3 times per week. Modern days, technology researches have shown us that we have more men that are less manly. Doctor, I'm being honest, I'm a man. We have more men that are less manly than they used to be. If you bring 10 men today, I kid you not, you will not get 5 that can actually sleep with your wife 3 times in a week and do the magic. People say I do 5 runs. My wife knows I'm a strong man. Because you do 5 runs is not enough for you to impregnate your wife. What is it that you are discharging to your wife? Most of us are very active sexually coming up as young guys. A lot of us are erratic. All this Gen Z generation, what a man can do, a woman can do better. You take Colorado, you take Cloud. Doctor. You take Wiz. All sorts of things. So you contract infection. So most time we see couples, we see partners, they really don't have a major problem. But the timeliness of their sexual intercourse is a problem. So those people don't need IVF. It is counseling, a little guide here and there, and the next thing, the baby is around the corner. For a fact, I'm saying it loud on open media, we have more men becoming less of men from our findings in fertility clinic. So men, don't just push your wife to the clinic. Accompany her. Get examined like your wife. If you want to become a father according to WHO, you should have minimum of 15 million sperm each time you release. And the amount of good ones in this 15 million should be around 40 to 45%. The moving one that can actually travel the journey between the vagina of the woman to the ovary where the eggs are being released, they must not be less than 30 to 35% of your 15 million. With the numbers of men with increasing sperm quality going down, the number of men that come to the clinic with poor sperm quality is running high. For economic stress, metabolic stress, oxidative stress, we don't rest. We don't go on holiday in Africa. You don't have 10% of people in Nigeria that go on holiday annually. We are working. And the next thing you see a man that wants to go on holiday, he's going with his girlfriend. And he says he's going on holiday to rest. Are you stressing yourself more or you are resting? So these are the challenges that compromise the quality of the sperm. So if the sperm is good enough or is borderline and the man produces adequate volume, we are going for conventional IVF. But where the sperm falls below 10, it falls below 5, we are going to the senior brother, the uncle of IVF, ICSI. We're going to get there one day in one of our episodes. Intracytoplasmic sperm injection. That treatment option established that no matter how bad your sperm is, you have the chance of becoming father of as many children as you desire to be. Normally, the woman produces 1 egg, occasionally 2, once in a month. But this 1 egg or 2 eggs are not enough to get her pregnant in assisted reproductive technology that we call the IVF. She goes through some medications and injections on a daily basis with recurrent ultrasound monitoring, which tell us how she's responding to the medication, wherein we know either to step up her medication or to maintain and sustain the dosage she's on or to reduce. The sperm of the man is purified, removing the non-sperm constituents from the ejaculate. This pure sperm is assessed again, and you're sure that this volume, this count, is good enough for fertilization of the egg from the woman. And exactly 14 days after we put the embryos into the prepared uterus of the woman, we are collecting the woman's blood to check for pregnancy or not. And there and then, Hallelujah! And somebody, and you see the couple, some of them break tears. The 9-month journey has a whole lot to do with the sperm in the early going. The first 3 months of pregnancy, if the sperm of the man is compromised in one way or the other, either diagnosed or not diagnosed, where a woman is gynecologically fit and she recurrently have miscarriage, don't chase the woman around, don't beat her up. The man that is claiming that he's fertile, the test results show that the man is fertile. There's more that has to be checked about the sperm of the man. Is that there's what we call cardiothoracic obesity. When a man is overweight, when a man has the features of a grown-up woman, of a grown-up female, the man has breast like a woman. The man breast produce milk like a woman. These are telltales that there is problem around the corner. Such a man might struggle over time to impregnate his female partner. Whether you have 9 inches penis or you have 4 inches, the bottom line is that the penis plays a role of making you to enjoy the sex, maybe a little more for the man or for the woman. And it helps you to convey the sperm from where they are deposited in the reservoir into the vaginal canal, where they can access the route for fertilization of the egg of the woman. But what size it is, how wide it is, has something to do. The most important is what the penis is discharging into the vaginal canal. And that goes through the cervix, through the uterus, through the fallopian tube, and from there, ability to do the magic. The older couple are far more receptive and very realistic. They are usually less egocentric because it's all done on them. They want babies. Of course, they have made all the money. They made the world. But the woman is still crying middle of the night. The man, after a hectic day, after making the billions, he wakes up in the middle of the night to go pee. And the next he meets the wife crying. The money doesn't matter at that time. Tomorrow morning, we are going to that clinic. Where did you say that clinic is? That's where we're going tomorrow. And the woman becomes happier. And then walk in, they are listening. Those one count for every exam. When we're in primary school, there's a level of score you must attain before you cross to secondary school. Okay. When you don't get to that score, they say you fail common entrance. Am I correct? Yeah. The same thing going to the higher institution, there's a minimum acceptable performance in 5 subjects before you can go to university. The same thing goes to the sperm. The WHO has set a standard that the man must have 15 million sperm density, and the percentage motility should be around 30% to 40% minimum before you can father a child. When a man has below 15 million, when the motility falls below 30%, such a man is said to have low sperm count. Age in no way is a factor to fertility treatment. When it comes to men, when you're talking about women, you may be considering age and other factors. But when it comes to a man, the possibility of aneuploidy and all that can be taken care of with proper treatment. From the moment you have become matured, after 18 years of age, you know someday, somehow, you're going to have a female partner who is going to be your wife, who you expect to give you children. So the decisions you're taking from the moment you are around 18 going forward, they are very critical and they are pivotal. If you indulge in alcoholism, if you indulge in drugs, some guys take, some of our young males take hormones, injections, just for them to be macho. All these anabolic steroids. Some take cocaine, some take marijuana, isn't it? And a lot of times, there's this thing they call omieja in the Nigerian part of the world. There are some sort of local delicacies that the boys take as aphrodisiac. It makes them feel up there. You see, masturbation, you should come with the age and maturity. Okay. In those days coming up, you don't have the boldness, you don't have the wherewithal to approach a lady, but you're having the urge of orgasm. You want to release. Men, your young boys, they indulge in that. And we have adult men too, who indulge in masturbation. But the fact that you masturbate regularly has no direct relationship with male infertility at all. Of course, for a transient period, you masturbated yesterday, you are appearing in clinic today for sperm check. The count may be lower. It does not necessarily going to have effect on what? On the motility, on other factors, other parameters of the sperm. In the long run, I will tell you authoritatively, masturbation will end up helping a man's infertility.
Wow.
Why? Because it's a reservoir. The sperm are not just coming from the testicle and then to the outside. They are being manufactured and stored in a place. When you don't empty that reservoir, the water begins to still. A particular cycle starts from consultation, investigation, through the entire injection and medication, the theater work, the laboratory work, embryo transfer. When you do embryo transfer and the patient goes on with their medications, and 2 weeks down the line, you did the pregnancy test, and the patient test negative. That particular cycle is said to be a failed IVF cycle. It does not mean that the patient is a failure. Neither does it mean that the clinic in that regard is a failure. Perhaps there may be a few things that you need to look into, review, tweak, and then go at it again. And the next thing you see, the story changed. Some of them think the IVF treatment is like a Corolla. You go to a dealership shop, you pay to the clinic account, and the next thing you expect them to pick the baby from the shelf and give to you. Unfortunately, IVF doesn't work in that way. The diagnostics of IVF failure has a direct relationship with the diagnostics from the beginning. If you understand and identify the challenge and the peculiarity of this couple, then you know which treatment option suits them the most as per their diagnostic reports. But where for one reason or the other, there is no deep, high-level diagnostics on the part of this patient, you might actually have missed something that could lead you to success. Such a cycle is erroneously failure. You cannot have a successful IVF treatment cycle without successful implantation. And it's a very transcendent moment in IVF. A lot of patients, you get transfer embryo today, and the next thing you are traveling to Igotako, you are flying back to the United States. My manager is already calling me. You are flying back to UK. If you board flight today, you had embryo transfer today, and you are boarding flight today back to your base, which is hours of flight away from Nigeria, hours away from Lagos. Because you could be in Nigeria, but you live far away from Lagos. You are going to have to fly or you have to drive by road. There's no way you're going to take 5 hours flight, 6 hours flight before you get to the airport. Waiting at the airport, it can be very tiring. Nothing contradicts you traveling or flying in IVF. But in the early going, anything that poses stress on the female partner who is carrying this pregnancy is also an enemy of IVF success. The clinic is not going to perform magic. It is what you give to us that we give back to you. And the male partner has a role to play. The female partner has a role to play. The clinic has responsibility in managing this seed of life. Even if you produce semen and you are producing less than 1 drop, if you cannot get sperm from your penis that you release, we can always go into your testicles to harvest a biopsy. With this biopsy, the sperm you don't want to give us from the container, we will harvest it. And by the time we harvest it, we're still going to use it to do an advanced IVF procedure called ICSI, intracytoplasmic sperm injection. That's an advanced practice. We've been on this for over 2 decades. We know about it. We have the facility. By the time we used it, be sure of yourself. Take your baby to Australia for DNA test. It's still going to be you. So no matter how bad your sperm is, we're still going to be able to bring you your children. If you start the journey with proper counseling, due knowledge, expectation management, and all that, give or take, everybody knows IVF is not cast in stone. It's not like you go to a car, bought, you pay money, and you pick your Venza, you pick your G-Wagon, and you're driving. You, the patient, equally have a role to play that the clinic have no control over. So when you go 2 weeks down the line after every transfer, and you're back in the clinic, when we check your blood to check for the pregnancy hormone, if it's there, lucky us. If it's not there, it's a matter of us sitting down together, look at why and what could have gone wrong. What we need to do differently for an expectant mother, for a woman desiring the fruit of the womb. Most of the time, the 2 weeks they have to wait after embryo transfer is like 10 years. They are restless, they are expectant, and they are weary. But from the experience of the years, talking to them on a daily basis, a nurse is assigned to the couple, especially the female partner, talks to them, check on them, how they are taking their drugs, what are they experiencing. The report coming from these interactions under 14 days, it gives you an idea
of your probable landing point. When you meet a patient that just had a failed IVF cycle, especially the women, they are actually the patients here most of the time. They went through all the injections, took all the pains, exposed their body all the time and time to the doctor. At the end of the day, for all the stress, maybe they fly down from outside the country, they are traveling from outside Lagos to Lagos State, and the test became negative. Oftentimes they will break down. It is normal for them to break down. Let them pour out the tea. If you start the journey with proper counseling, due knowledge, expectation management, and all that, give or take, everybody know IVF is not cast in stone. It's not like you go to a car, a lot, you pay money and you pick your Venza, you pick your G-Wagon and you're driving off. Does it mean that the clinic did not do the best? Absolutely no. It was just a matter of timing or their own compliance as well. If the woman failed to comply appropriately, the cycle can fail with regard to what she eats, where she goes to, the lifestyle she lives. The social life choices the woman keeps is directly related to how quick she will get pregnant and the chances of full-term pregnancy. There's no emergency about IVF. You might not be in the best frame of mind. You might put a lot of things in the bucket at the same time. Take one step at a time. Come back when you are mentally ready and discuss your past. Discussing your past illuminates the future. An IVF cycle failed, you return back to the team. If you are so convinced they gave you the best, to sit down and do a review. Perhaps there might be need for change of protocol that was used for that IVF. There might be need to change your own approach to the couple back home. The endeavors you engaged in after you left the clinic upon embryo transfer. The timeliness of your medication. Let me share a story with you. We had a couple some time ago. This couple have had about 2 cycles failed somewhere. They came to us. And for all intent and purposes, Omega Golden Fertility will show you your embryos. You will seal them, you will snap them with your own phone. We will have it sent to your email if you so desire. So you could see, and in any event, you could show another professional wherever, however, anytime. This is what I got at Omega Golden Fertility. The person will tell you whether it's the best of the best that was put into you or not. How do you blame the clinic? By claiming your wife, transfer was done around 6 p.m. or 4:30 p.m. By 11 p.m. in the night, you are engaging in erotic sex with your wife. 3:30 to 4 in the morning, you are back in the woman's room. The woman struggled and struggled. The doctor said no, but he told us now. The man turned his eye and was turning to chaos. The woman had to submit.
Bacteria, the microbial agent generally in seminal fluid, affect conception in natural scenario. We will not say in entirety that it doesn't have the treatment of IVF. However, like I said in some of our past episodes, the man had undergone screening. And if there's bacterial cell in the clinical threshold in his seminal fluid, automatically the lab man reports it, the doctor sees it, the gynecologist is concerned, and they offer treatment for this man before IVF treatment is done. However, still, the way and manner in which IVF treatment is done, the way the sperm, the seminal fluid is being separated to remove the sperm cells, it precludes the infiltration of bacterial cells, except there's any error anywhere. No matter the bacterial infestation in a man that has good sperm count, that the DNA is good, the embryologist in the IVF unit, they have what it takes to remove the bacterial cell. The reproductive material is used in turning the egg of the woman to become embryos. The seminal fluid in human, like you said, you call seminal fluid because you are knowledgeable. Seminal fluid contains sperm and so many other secretions from different glands, but the common man will call it sperm. Each of these secretions play their own role, positively or negatively, to the sperm, depending on what is happening along the duct, the spermatic duct, and the glands where these secretions are coming from. When you talk about microchimerism will not come without telegony. Telegony came more than 500 years before we now heard of microchimerism. What do we call telegony? Telegony means that I have been dealing with you, I've been relating with you, we are having some things internal, but we are no longer together, but a little bit of me, it goes around with you. So they brought this to reproductive animals, as we demonstrated and spoke about the insects. Now further researches have shown that this happens in mammals where human beings belong, where a male that had sex with a female partner in time past, some non-genetic material of that particular male are still in that woman, and that can be presented in another generation of children. As far as IVF treatment is concerned, if you look at it, it is capital intensive. It is well beyond the regular fee of malaria typhoid treatment. So it is not a news that semen of men harbors bacteria or microbial agent. And we equally know before today the extent of damages that these bacterial cells, the fungal cells, are capable of doing. So you won't know the harmful effect they have to offer and still go ahead and use them that way. The man is already a week before treatment on the drug that covers him from this bacteria. On top of that, on the day of IVF treatment, when the wife is taken to theater and the egg is harvested, or when the egg donor is taken to theater and the egg is harvested, the man's semen is treated in a way scientifically that remove the bacterial cells, that remove these fungal cells. If at all they have not been finally killed before that day, such that the sperm you are taking out from that seminal fluid by way of the purification system is called the pure. And when science say pure, it is pure. This is more of an admonition rather than condemnation as far as our women, young females, young adults, young ladies is concerned. If you go back, one of the greatest philosophers of all time is Aristotle. He had postulated this years ago and had evidence that in insects that were defined by a particular type of male that were later impregnated, fertilized by another male, the children, the offspring of this insect, had traits with regards to physical appearance and size that is traceable to the first particular type of male that mated with the female. There is evidence that female mammals, what do we call mammals? Animals that have what? Here on their screen. They have the mammary gland, they can breastfeed, and they can give birth to baby. This category is where human being belongs to. They are vertebrate. They find out that female rats that were defined, they are mated with a particular type of male rat, but they didn't get pregnant then. Young female rats had sex with a particular type of male rat. By the time this female rat got pregnant from another young adult female rat who had mated with a particular type of male rat, but they didn't get pregnant from that sexual encounter. By the time they got pregnant by another male rat, the offspring, the babies of this rat, this newly given birth, this newborn rat, the babies were of the size of the first one who mated with the mother in the beginning. According to WHO, for a man who wants to be a father, you should have 15 million sperm density upward. You must be going up north of 15 million. So you should produce at least 2 mils of sperm each time you release your ejaculate. So where your sperm, your semen production is lower than 1 mil or 1 point something mil, and the count in it is also lower than 15 million, you are also said to be called low sperm count. However, the low sperm count is what we call oligospermia. Oligospermia is in 2 ways. It's either the body itself is not even producing sperm, or it's producing in low quantity. Are you with me now? Or that is non-obstructive azoospermia. It's also possible that the body is producing enough sperm, but the route where this sperm will travel through to get out, there are occlusions and bridges on this road that the sperm cannot cross. But social lifestyle choices, the hard drugs you take, the indulgence in beer, your indulgence in whiskey, destroys the carb, the acrosome on the sperm. And once the acrosome is destroyed, the chances of spontaneous pregnancy is removed. It takes a fertility expert, a scientist that is a specialist in sperm and sperm-related problem, an andrologist to diagnose this. And you can only find that in fertility clinics. I won't say all the fertility clinics have andrologists, but the good number of fertility clinics in Nigeria they have andrologists in-house, or they hire andrologists to come and check the sperm so that they can tell if the sperm is good enough to push the journey. In any event, by the way nature made it, the journey from the first day to the complete maturation of sperm is 65 days to 72 days. If you divide that by 7 days in a week, that is 10 weeks. Worst case scenario. In a space of 10 weeks, your sperm is back. So if you are the one that smoke, a chain smoker, 10 sticks in a day, 1 packet in a day, you take loud, you take shisha, you take Colorado, you take all sorts of. Give yourself 3 months off. Then come to the fertility clinic. We put you on medication. You will definitely come back smiling. You will scale it. It's 2-3 months. Once you know you are ready to discipline yourself for 3 months, come to us immediately. We are not doing further damage to your body. We are correcting the damages you have done. When you have miscarriage, time and time again as a woman, don't go to the hospital alone. Go with your husband. If your husband is not ready to follow you, don't go. Typically, PCOS is an hormonal disorder wherein the hormones produced by the body from the brain downward, they are not being produced in the right proportion. Some are not coming up. Some are coming up inadequately. But beyond that, there are other contributing factors that can make a woman's ovary not to release egg at the end of the month. And one of that is social lifestyle choices. Every month, a woman produces 1 egg. Occasionally 2, 1 on each ovary. That is 1 egg apiece at the end of every month. However, in polycystic ovarian syndrome, the person produces far more than the body can manage all in one cycle. Because the body is designed in a way wherein these follicles are recruited. But there's a system from the brain that suppresses every other follicle and keep 1 that the body can sustain for that menstrual cycle. A number of ladies, all you want to talk about, I have done hormone test. They say my hormone is okay. Which hormone and which hormones were investigated? How does this hormone values, the result of the laboratory, relate back to your body for treatment? Many a time, what we hear is FSH, LH, prolactin. The doctor said my hormone is okay, and progesterone. They are subjective investigations, and they are what we call objective investigations. All these come together as a bunch to give us holistic definition and classification of a patient. When you look at some women, let's be real, as a walk-in, you already know where they belong to. You're looking at them, you know this is a PCOS patient, even without any test. But sometimes you need to dig further to put the resources together to have a pinpoint accuracy in your diagnosis. And when you run tests, there's one of the tests we call anti-malaria hormone. When you don't do anti-malaria hormone, the normal range is between 2.02 to 4. In typical PCOS patients, they are always in excess. The normal ovaries, we have 7 follicles here, 7 follicles here at the beginning of the cycle, and they will end up with 1 egg ovulated. But in PCOS patients, when you scan them to check their antral follicle, on the 2nd day or 3rd day of the menstrual flow, that might sound messy to the regular practitioner, but to us, is our focal point. Apart from physical traits, signs and symptoms that put you, exotism, when you have ears on your body as a female, typical women have smooth skin that is inviting. Am I correct? But when you see a typical man that is a hustler, you see hair all over the body, on the leg, on the lap. When a woman shares this trait, automatically you are a polycystic ovarian syndrome patient. And you see some of our ladies, pay attention from this moment on. You see them having, some have 1 or 2 strands. Some grow it like mine, and they are always shaving it, using cream to shave it off. Those are PCOS patients. Some ladies, when they open their bra for you, you will realize that there's a few hair growths, 6, 7 of them, between their 2 breasts. Those are signs of polycystic ovarian syndrome. When you see that, if you are not married and you are seeing that, you automatically know that one of the things you need to pay attention to before you marry in your premarital screening is reproductive test. I'm going to tell you the way it is. And for top class fertility clinics, polycystic ovarian syndrome patients, they lose not even 0.5% chance of success when they are in the hands of a fertility expert. Their chances
are like normal working women who don't have issues. And if well managed, they have economic benefit. Because if well managed, they produce more eggs than the usual regular female who don't have PCOS. So they produce more eggs than a regular person will produce. With the sperm of the husband, with the right selection of treatment options, they have plenty embryos than they can take in one cycle. So when you transfer embryo to them, 3 embryos or 2, as the case may be, trust me, they are going on to become mother. If for what any reason, inadvertently, that cycle did not work out, rather than pay a whole treatment fee all over again, they only pay a fraction of that treatment fee because they have embryos frozen. And we can always pull out these embryos that have been stored for them. Pick 2 out of 3, warm them up, transfer again. And that means they are getting 2 for the price of 1. How good does it be? It doesn't come better than that.
Yeah.
PCOS is no challenge if you go to the right place for treatment and management. And when it comes to treatment and the chances of becoming a mother, you are in the luxury class. That's it.